Okay, so of course the doctor orders for them to start everything, and the nurse has me hooked up to everything. We have a conversation about how I'm concerned about how the horror stories I've heard about the magnesium drip, how bad it is. And she tells me, well, for some people it's a problem, for some people it's not. She's like, I'm going to give you the Zofran in case there's an issue. I will say I did not feel nauseous. The only side effect from the from the magnesium that I had was that out of nowhere, about 10 minutes after she gave it to me, I started feeling incredibly hot. Like originally I was cold when I got in the room, and they had me with all of these blankets that were warmed. And I was in there, literally, I was fine. I was cold up until the magnesium kicked in. And then I started sweating, and I was hot just laying there. So she turned the air down, and of course she had already started the Zofran. And it only lasted maybe 5-10 minutes where I was really hot. And then it stopped, and I was fine. I didn't have any other side effects that I know of. So for me, the magnesium drop wasn't horrible at all. So those folks that tell you that it feels like the flu and you're having a whole bunch of other problems, I didn't experience that. I just felt hot for a little bit, and that was it. But which was surprising to me, because I'm one of those people, normally I get just about every side effect in the book, and it's an issue. So I was okay with that. So, of course, she gives me the steroid shot. The steroid shot, for those of you who don't know, is in your butt, sort of in your hip butt area. But it didn't really hurt. It was a very small needle. The IV was going with regular fluid, and that was pretty much it. They were monitoring my blood pressure. Blood pressure was okay, not super high. At first, it was, just regular. And then by the time the magnesium kicked in, my blood pressure was excellent. And I did ask about that. I'm like, hey, you guys are admitting me in the hospital. I know you're keeping me. You're definitely keeping me until the babies get here. Are you going to order my medication I take at home, because I didn't bring it with me, my blood pressure meds? And he told me because they had me on the mag drip, they would not put me on the blood pressure meds at the same time. They said the magnesium would naturally bring my blood pressure down too. And I was like, oh, okay. So they had me on that, and I pretty much just, I was fine at first. I told the nurse, I was like, I'm having contractions about every 15 minutes apart. She's like, well, I don't really see any on the monitor. I'm like, I'm telling you, I'm having them. So they were about 15 minutes apart. She came in and out. She was in my room nearly the entire night. I will say that. Excellent job. Wonderful nurse. Just as a side note, the nurse that I had, she is originally from Canada, and she was telling me, about some of the differences in healthcare and how they do things here, how they do things there and here, and I thought it was interesting. But she kind of entertained me with her stories from home, which I found great. I really appreciated that, because it kind of kept me calm, because I was still a little anxious after him telling me I'd have to have a C-section. So she was there, wonderful nurse. The babies kept popping off the monitor. So she literally, bless her heart, was in my room at least every 30 minutes trying to fix them and adjust them. She ended up going on lunch, and when she went on lunch, I noticed that the contractions had kind of picked up, and they were starting to hurt a little more. And I'm sorry, right before she went on lunch. So she says, okay, let me give you a shot of Stadol. Stadol should kind of make the contractions calm down some. And it should also take away a little bit of the pain. Now, I've had Stadol before. Last time I had Stadol was with the last birth of my child, who's almost 14. So it's been a minute, okay? My body is not as young as it used to be. I get that. But I will say, before, when I was on Stadol, I remember being a little out of it. It would kind of take the edge off and make you sleepy. Okay. She gave me the shot of Stadol. Not only did it make me sleepy, but it literally made me feel like my head was pressed against a wall and my chest was caving in. You know how, like, you're on a carnival ride or at the fair, and you're in that thing where you stand straight up and it spins around and around, and your centrifugal force keeps you up against it? Okay, it was one of those kind of feelings. It felt like they were crushing my chest and my head, and my face was, windbreak. I mean, it was crazy. And I was just like, oh my goodness, this does not feel right. But it was very weird. I did not feel that before, and I had Stadol with both of my other two kids, so I don't get it, but fine. And I told her that, and she said, some people, it will make you feel like the pressure, and I'm like, dude, this is not cool. It feels very strange. But I will say, the contractions didn't necessarily hurt anymore. Now, instead of hurting, it was pressure, just like the pressure on my face and my chest. It was just pressure down there too. So that was very interesting. But, I started complaining of having pain. But, she was like, well, we'll check you in a little while. I don't want to introduce, too much bacteria down there, so I really don't want to check you too often. And I understood that. So I was like, okay. So she goes on lunch. I explained to the nurse who was taking over for her. I'm like, you know what? The contractions are really, really starting to kick in. I was like, can you please, tell me how far apart they are now? And she said, oh, you're about 5 to 7, about 6 months apart, somewhere in there. And I'm like, okay, that is an issue because you've given me MAG, just saying out loud, you've given me MAG, you've given me Stadol, you got me on this stuff, and it's not working. The contractions are not supposed to be getting closer together. They're supposed to be spacing apart and going away. So she's like, true. She's like, but your nurse is on lunch, so she comes back. We'll kind of see where she wants to go from there. I said, okay. My nurse comes back from lunch. She's like, hey, I see you're having some contractions, because they can see them. Well, and I'm sure it's this way at every hospital, but I know at ours, the screen that you can see, and if I can figure out how to insert pictures on here in the video, I will. I may not be able to, but I'll try. But the screenshot shows you as a patient in your room, what your levels or contractions are doing, and it shows all the other people in labor and delivery. Now, at our hospital, I think they have 15 labor and delivery rooms, so it's kind of neat because I was in labor and delivery room number 14, so I could see me, and then I could see everybody else who was in labor at the same time. Now, when I got there were not that many of us. By the time I left, there were definitely more of us. Now, triage had been packed, but they weren't all in labor, which is why, earlier when I said triage, they were full, but the labor and delivery rooms weren't. So anyhow, I'm looking and I can see them, they look like little mountains on the little monitor, and I'm like, okay, they're about between 5 and 7. I'm like, yeah, they're picking up. They're not supposed to do that. So she's like, okay, we'll wait till she gets back. So my nurse comes back. She's looking. She's like, yeah, they're picking up. That's not good. And so she's like, let me call in an order to see if I can increase the magnesium, and I'm going to see, can I give you, I want to say she gave me morphine. Now, I could be totally wrong, and not that it really, really matters at this point. I mean, I could find out, I'm sure, and get a copy of my records and see what all they did. But I'm almost positive she told me she gave me a shot of morphine the second time instead of another shot of Stadol. I'm almost positive she said morphine. But so we'll go with morphine. She's like, let me see if I can get that ordered, and I'll be right back. So I said, okay. She's gone for a few minutes. She comes back. The time it took her to go get the orders, which wasn't long, I know she wasn't gone long, my contractions had moved to about 3 minutes apart. She turns on the mag. She cranks it up. She got the order. She gives me the shot of morphine. We wait a little bit. The babies are coming off the monitors. She's still trying to work the monitors and get everybody back on. And she's having a little trouble. But she gets them on there. She checks me. And she's like, okay, she's like, the amount of pain, well, I'm sorry, because I was complaining. It's like, ow, ow, this is starting to hurt. Now, I wasn't like in tears. It wasn't like, oh my goodness, this is the most excruciating pain, because I've been in labor before, and my first child had epidural, second child went natural, so I know what it's like to be in, labor and feel it. So it wasn't bad, but it was no longer comfortable to chat at the same time anymore. So she checks me, and I'm at 4. And she's like, okay, that's a problem. She's like, not only are you dilating further, your contractions are getting stronger, the medicine's not stopping it. Let me call the doctor back and see what he wants to do. Now, it's roughly 2 a.m.-ish, okay? And she gets ready to call him, and the baby pops off the monitor, one of the babies, and which I'm pretty sure was baby A. And she's like, okay, let me get the baby back on the monitor. She can't get the baby back on the monitor. She's trying. So she calls in another nurse to come in to help. The other nurse comes in to help. And she is trying to get, I'm sorry, let me back up something I did not mention earlier. I don't know if I said it or not. My nurse from Canada was a nurse that came on at 7 that got them on the monitors to begin with. Because remember, I said when I first got there, they were having a lot of trouble getting them on and they were struggling. Well, they couldn't get them on. And then she came in, she got them on. So this is the nurse that I had the rest of the evening. And I'm going to stop the video there and start with part 3.